Slight bleeding, burns, and sprains are common injuries that happen in our daily lives. One of the traditional methods for treating a minor burn was to rub a soy sauce on the burned area. Today, we'll find out how this works and see other treatments for emergencies in Oriental medicine.
Most external injuries are accompanied by bleeding, and this bleeding is due to the capillary vessels that are close to the surface of the body. In most cases, pressing down gently on the injured area will stop the bleeding, but if the blood is bright red and gushes out like a fountain with every heartbeat, it is arterial blood, and the injury could be fatal. On the other hand, venous blood is dark red and gushes out regardless of heartbeat. Rather than treating just the external injury, Oriental medicine concentrates on internal problems connected to the injury.
Nose bleeding is caused by heat that first accumulates in the organs and then enters the bloodstream. To treat nose bleeding, we have to find out which organ is causing the problem. Heat in the lungs is the usual suspect. For nose bleeding, acupuncture is applied to the following: the 영향혈 on each side of the nose, the 수구혈 under the nose, the 합곡혈 between the thumb and forefinger, and the 소상혈 on the thumbs. In this way, the heat that caused nose bleeding is removed.
When it comes to burns, Western medicine places top priority on preventing infection, whereas Oriental medicine emphasizes the preservation method. Oriental medicine treats burns up to 2nd degrees burn. Emergency treatment involves immersing the burnt area in salt water, and it is very important to do this immediately. This relieves pain and prevents blistering. Salt has a lot of cold 기운, which cools the burn. Food preserved with salt, such as 장조림, ham, 마늘장아찌, can be kept for a long time because of the cold qualities of salt.
In Oriental medicine, treating burns concentrates more on preserving the area around the burn than preventing infections. Burns are treated using cucumber, radish, aloe vera, or salt to remove heat and germs from the injured area.
As common as light burns are sprains or dislocations of the ankle. It happens to women who wear high heels and to people who exercise too vigorously. The characteristic of dislocated joints is heavy swelling, and in Oriental medicine, those who get their joint dislocated often are considered to have problems with their internal organs as well.
When you have sprained your back, the most important thing is plenty of rest. Next, the physician will let out blood from the 위중혈 behind the knees. And 지음혈 on the little toes to restore overall balance. After that, acupuncture is applied to the 신수혈 between the 2nd and 3rd vertebrae, and the 대장수혈 between the 4th and 5th vertebrae to soothe away the muscle tension.
Emergency cases arise in our daily lives. Even in the course of a basketball game, receiving and passing the ball and jumping can damage the hands and feet.
The most common of sprains is the ankle sprain. For ankle sprains, use an ice pack to minimize subcutaneous bleeding. After bruises have faded, use hot packs to relieve tension in the tendons and muscles. Acupuncture is applied to the taechunghyeol between the big toe and second toe, the jungbonghyeol in front of the ankle bone, and the sobuhyeol between the ring and little finger of the hand on the opposite side of the spraying foot. In this way, tension is relieved from the sprain. For wrist sprains, the area around the wrist joint is used in the treatment. Acupuncture points include the Yangge, Yangji, and Yangokhyeol, the Hapgokhyeol between the thumb and forefinger, and the Wiguanhyeol about 3 centimeters above the wrist joint.
Besides this, Daehwanggo or Yonghwasu can be applied to the injury. Daehwanggo has cold qualities that can relax hair that have bunched up due to heat. Yonghwasu is more effective than para-aminosalicylic acid in dissolving congested blood. Bad posture when sleeping can slowly take its toll on the back and neck area. If you have aches in your back and neck right after you getting out of bed, you should receive treatment to correct your posture.
Neck sprains, where it hurts to turn the head, are commonly caused by sleeping in a bad position. In this case, it helps to massage or apply Puhuang therapy on the area around the larynx. But it is better to apply acupuncture to the sangmekhyol between the fore and middle finger, as this quickly relieves tension in the muscles. The right sangmekhyol is used if the patient has trouble turning his head to the left, and vice versa.
Oriental medicine regards external injuries not just as simple surface wounds, but as the result of disturbance in the body's harmony. The liver is in charge of the muscle, and the kidney is in charge of bones. So those who habitually get their joint dislocated need internal treatment. Those who repeatedly sprain a particular joint, such as the ankle, probably have something wrong with their body symmetry, with the spine as the axis. Such people need to correct the fault in their symmetry.
Oriental medicine believes that severe cases of hemorrhage or bone fracture may come from malfunctioning of the internal organs. Avoiding stimulating food and exercising can enhance the energy circulation to protect our body from external pressures, thus lessening the chance of bleeding and bone fracture. Thank you, and see you again next time.